All right, this summer we've been hearing reports about a variety of viruses, including EEE, West Nile, and mpox. Joining me to discuss what these diseases are and how to stay healthy is Dr. Paul Anthony, infectious disease specialist at Hartford Hospital. Welcome.
Thank you for having me.
You bet. All right, Dr. Anthony, tell us about EEE. What is this? How dangerous is it?
Yeah, EEE is one of the viruses that unfortunately folks can get by mosquito bite, and it could be dangerous. Some patients may get little to no symptoms. Unfortunately, some others can get very sick with like what we call meningitis and need attention in the hospital. And if that happens, unfortunately, sometimes that means like maybe up to 30% of those patients may die.
All right, how does it differ from West Nile virus?
Yeah, I think some of the differences is that they both, in terms of similarities, they both can be transmitted by mosquitoes. But in terms of differences, the West Nile tend to have kind of a little bit milder course, if I can use that. The rate of death is a little lower in patients with West Nile.
All right, we're also hearing reports from folks about a deadlier strain of mpox. Tell us what you know about that.
Yeah, so it's out of what the country called the Democratic Republic of Congo. That's in Africa, and what the CDC and the WHO have been noticing is that unlike the clade 2 of the virus, so there's 2 different clades that's been causing the epidemic around the world in 22, if you remember, a couple of years ago. Now they're facing what's called clade 1, which tends to be a little bit more aggressive, and that is so far limited to those African countries. They had an outbreak in the Republic of Congo back in April, and now they're seeing a cluster of cases in the Democratic Republic of Congo and neighboring Burundi, Rwanda, and Uganda. So they're keeping a close eye on it. For folks in the U.S., I would say a couple of things. Number one is that there have not been any cases outside of Africa, and people are monitoring this. But if you are at risk for mpox and you have not completed the vaccine series, it's a 2-dose series of the vaccine, please talk to us and we'll be happy to get people vaccinated out there.
All right, thank you so much for your information today.